Initially, when I started college, I wasn't exactly sure what area I wanted to go into, but I did know that I really liked science and chemistry and those type of courses. So I had narrowed it down to either, medical field or engineering. And so I actually did start out with engineering as the focus. And then when I really got into some of the classes, I decided I wanted to pivot back to the medical field. And both of my parents work in the medical field. My father was a pharmacist, and he actually worked for the Indian Health Service. And then my mother is a registered nurse. So I had a fairly good idea of, what some healthcare professionals did. And then I just decided on pharmacy, and because I really did like the science and the chemistry and things of that nature, and enrolled in the courses. And I was lucky at the time I could squeeze in all of my, at that time there were about 60-hour prereqs. And so I was able to get in right after the first 2 years of school and keep on going. The people in my life that introduced me to the field really were my father, who was a pharmacist. And then I could go shadow him. And during, the prerequisite years, I did get a job in a retail pharmacy at Walmart just to get that area of exposure. And I worked there as a pharmacy technician. And I really did like, the people aspect, and that influenced me. And then now in my career, I did not stay in retail pharmacy the entire time. I'm the clinical pharmacy manager at OU Health Hospital. And my teachers in pharmacy school that were a few of my mentors really did kind of steer me to more of the inpatient clinical pharmacy side and really get to see how you can positively impact patient care for kind of the acutely ill that are in the hospital. And that really did kind of strike a passion in me in that area. I feel that pharmacists really are the gatekeeper to be that second set of eyes to check and do a safety check on medication and medical therapies that patients are on. And so some characteristics would be, very detail oriented or kind of type A, focused on details, as well as if you ask someone who works at a hospital, the first people they think of are, physicians or nurses. They might not necessarily think of a pharmacist in a hospital. We're kind of on the background, and we do work with all sorts of departments. So we have to have really good communication skills and be able to work in teams and have that, collaboration. So I think having good interpersonal skills with other caregivers. We don't really work in a silo. In my area as the clinical manager, my day is a little bit different, so I can kind of give you two views. So I have about 20 direct reports that are clinical pharmacists. So these are pharmacists that went to pharmacy school and actually did 2 years extra of residency, so 2 years of more detailed focus for like clinical training. And they actually work with a medical team. And so there might be the pharmacist, the attending physician, residents, nurses, social workers, dietitians. And so they all work in different areas. We're very lucky to have support by the hospital leadership to have pharmacists in, family medicine, the intensive care unit, solid organ transplant, different areas like that. So I have 20 of those. So typically I, come to work, check out what is on my calendar for the day or the week, and then, respond to emails. And then I look ahead and work on any projects that I have upcoming. So a lot of what I do is project management, and I can't do it all. So a lot of the pharmacists that report to me, we collaborate together. So they might work on creating, for example, one of our pharmacists created a eye care protocol. And what that is there are patients in the ICU that might be on certain drugs that paralyze them. Well, you have to maintain moisture in your eye or it can cause all kinds of problems. And so then we have this reflex automatic policy that she wrote, and then where we can automatically add those to the patient's electronic medical record. And so then I'm just kind of that intermediary where this is her idea, but I can help her take it to the critical care physician group and help her take it to the different policies that it needs to get to. So just looking ahead at what projects do we have ongoing and how do we keep momentum. So project management. Now the clinical pharmacists, which is really the exciting job, I feel like they get to work, they have a patient list. So for example, the family medicine team, they have a list of patients that are on their service, anywhere from maybe 10 to 15. And so that clinical pharmacist gets the list, looks over all of their medication profile, and checks and makes sure that all the doses are appropriate. Are there any medicines that need dose adjustments based on therapeutic levels? And they can actually look at pharmaceutical care plans and things like that. And if they need help or if they run into some weird issue, a lot of what we also do is drug formulary management. So what drugs does the hospital carry? And everything, is expensive. So we have limits. If there's a weird drug they want to use in a patient, but it costs $10,000, we have a process in place. So we can't just buy everything. It has to be reviewed at different levels. So those are some of the things I might help them with more difficult situations. So some of the interdisciplinary partnerships that we work with in the pharmacy department include the physicians that are writing the medication orders. And at OU Health, there's a lot of different types of physicians and different levels of physicians. So I think that's very exciting about working with a academic medical center. You get to work with learners. And then we also work heavily with nursing. So I feel like we're kind of that intermediary between the person that placed the order, we review it and dispense it, and work with nursing who administers the medication. So really we have a really large partnership with nursing, lots of back and forth communication with the floor nurses that are taking care directly of the patients that receive the medicines. So the fields that we work with the most, I would say, are nursing and probably the physician group, so OU physicians. And then we also do work, I would say, with laboratory some. We have 2 infectious disease specialty pharmacists that are residency trained in that specific area. So for pharmacy residency, you can do a general, critical care, ambulatory care, kind of what area you're interested in. And we do work closely with the lab regarding some of how the lab cultures and things like that are sent out. So we work closely with them, but probably the physicians and nurses the most. So in my journey to deciding kind of what career I wanted to choose, I also considered engineering. And I think it was just because I enjoyed sciences and that's what I excelled in school. But ultimately, I was drawn to the medical field in pharmacy. I liked that you could be scientific, but also have that patient care, aspect of helping people. The advice I would give to someone who's considering a career in pharmacy would be to reach out to any contacts that you have or your parents might have if they have friends that are pharmacists, and maybe go shadow them, and not just ones that work in retail pharmacy. Try to look at different areas of pharmacy. So there's a lot of different ones. There's retail pharmacy, which is your CVS, Walgreens. There is community pharmacy, which would be a different type of retail pharmacy, hospital, inpatient. There's different outpatient ambulatory care clinics. There's pharmaceutical industry. So there's all sort of different areas of pharmacy. So I would suggest to do some shadowing, and also whatever areas you're considering, do shadowing and maybe shadow several different people, because you might have different perspectives with everyone that you meet. I think with whatever field that you select, if it's in healthcare, or probably anything, anyone that you interact with, just to be kind and be kind, but also be truthful, because you really never know whose path you're going to cross later in your career. And the pharmacy industry and the pharmacy professional groups that I interact with, it's very small. So I did my postgraduate training in Dallas, and there's pharmacists that I have interacted with in Oklahoma, and it's almost like somebody knows everyone. Everybody knows someone, and your reputation can precede you. So I think just be kind and be very aware. When I was going through school, we didn't have all of the social media either. Whenever I'm looking for a candidate that's applying, I do go to the Facebook and I see what's on there. So I think knowing that things are different and things that you do can be perceived certain ways. So just be careful and be kind, and that's what I would suggest.